All right, let's dive into something that's been flying under the radar but has massive implications: the sudden loss of Haitian caregivers in New York nursing homes. Here's the deal. Last week, Cabrini Nursing Home in Westchester had to let go of 7 full-time Haitian caregivers because of a Trump-era policy shift on immigration. And this isn't just a one-off situation. It's part of a bigger wave affecting hundreds of thousands of Haitian immigrants across the country. But here's what makes this really interesting. These aren't just any workers. They're the backbone of the healthcare system, especially in New York, where immigrants make up a staggering 60% of direct care workers. Personally, I think this story highlights a massive oversight in how we talk about immigration. It's not just about numbers or policies. It's about the human impact, especially on the most vulnerable, the elderly in nursing homes. What many people don't realize is that these caregivers aren't just there to feed or bathe residents. They're often the first and last faces these seniors see every day. Simone Smith, from Cabrini's HR department, put it perfectly. These workers leave a void that's incredibly hard to fill. And it's not just about staffing shortages. It's about the emotional and cultural connections these caregivers build with their patients. Take Sabine French, for example, whose 91-year-old mother relies on a Haitian caregiver who speaks her native language, understands her cultural preferences, and even watches Haitian news with her. Finding a replacement isn't just about hiring someone new. It's about finding someone who can step into that deeply personal role. From my perspective, this raises a deeper question. How did we become so dependent on immigrant labor in healthcare, and what happens when that labor force is suddenly removed? The numbers are eye-opening. According to a KFF study, immigrants make up 30% of direct care workers nationwide, and in New York, that jumps to 60%. And it's not just Haitians. TPS recipients from other countries are also at risk. This isn't just a policy change. It's a potential crisis for an already strained healthcare system. Stephen Hanza, from the New York State Health Facilities Association, called it a long-term care workforce crisis, and I couldn't agree more. With the over 65 population booming, we're already struggling to find enough caregivers. This policy shift feels like pouring gasoline on a fire. One thing that immediately stands out is the timing. This is happening amid a nationwide shortage of elder care workers. The Supreme Court's decision to end TPS for over 300,000 Haitians came in June, and protections officially expired in July. Meanwhile, the administration argues that TPS has been abused and is no longer necessary, even as they warn U.S. citizens not to travel to Haiti because of civil unrest. Personally, I think this is a classic case of policy disconnect. On one hand, we're saying it's too dangerous for Americans to go to Haiti, but on the other, we're sending Haitians back there. What this really suggests is that immigration policy isn't just about borders. It's about the fabric of our society, especially in sectors like healthcare that rely so heavily on immigrant labor. If you take a step back and think about it, this isn't just a New York problem. It's a national issue. Karen Lipson from Leading Age New York pointed out that these roles require significant training, and most facilities already have open positions. Adding more vacancies to the pile isn't just inconvenient. It's potentially dangerous for patients who rely on consistent care. And let's not forget the emotional toll. For older adults, especially those with cognitive impairments, losing a familiar caregiver can be devastating. You can't just swap out someone who's been a companion, a cultural bridge, and a lifeline. What makes this even more frustrating is that it feels avoidable. Immigration advocates argue that ending TPS is part of a broader crackdown on both legal and unlawful immigration. But in my opinion, this is where we need to separate politics from practicality. Healthcare shouldn't be a pawn in policy debates. These caregivers aren't just workers. They're essential to the well-being of thousands of Americans. So, where does this leave us? Personally, I think this story is a wake-up call. It's not just about fixing a staffing shortage. It's about rethinking how we value and support the people who care for our most vulnerable populations. If we don't address this, we're not just failing Haitian immigrants, we're failing the entire system. And that's a thought that should keep all of us up at night. What do you think? Is this a policy failure, a systemic issue, or something else entirely? Let me know in the comments below. And if you found this analysis insightful, don't forget to like, share, and subscribe for more deep dives into the stories that matter.